Okay, welcome. Thank you so much for everybody that's joining us tonight for another exciting installation of Family Protection Planning webinar series. We are joined tonight by Jolene Harrelson. She is a pre-licensed marriage and family therapist supervised by Dr. Robyn Flores. She helps individuals and couples with planned and unplanned life changes. Tonight, she's going to talk about busting some common myths about therapy, as well as the path to permission and why therapy shouldn't be mysterious. We will learn more about what to expect from working with her and what the therapeutic experience looks like as a whole. This can relate to our family protection planning webinar series in so many ways, including the loss of a partner, parent, sibling, business partner, as well as dynamics that come up with siblings while settling in a state, anything to do with money and what to do with it, the complexities of grief after the loss of a loved one. So welcome, Jolene. Thank you so much for being here with us tonight. We're excited to hear what you have to share with us.
Hey, thanks so much for the introduction, Nicole. Grateful to be here with you and with all of you that are listening, and to partner with you to support our clients in all those ways that you described, the planned and unplanned pieces of life. So um, it's not uncommon to face these major life events or decision points and to think to yourself, because like you'll have the planned piece, right? Like, here's what we're going to do when this happens. But then whatever happens, happens, and it could be something completely different. And so you might think to yourself, something has to change, but I don't know what, and I don't know how, and I don't know where to start. So I work with a lot of clients at the intersection of a result of feeling alone with their problems, remaining stuck or being stuck, or in a place of just unwanted stress and overwhelm. And it can really seem like you're hopelessly repeating the same patterns or conflict, or kind of trying to get off the hamster wheel. So I'm happy to be here. I'm grateful that you invited me to share with this group so that we could kind of take a peek at what does therapy look like. I put let's talk because sometimes there's talking in therapy. I don't say that in a humorous way because there's many different types of therapy, many different interventions, and many different modalities. But that starts even before people get to therapy or even get to thinking about going to therapy or even therapy as an option. So I like to start out with common myths about therapy, because I want to meet my clients where they're at. And if they feel like one or more of these things is going to be a roadblock, I want to be able to try and talk to them. So the path to permission, or your path to permission, is an opportunity to take some of the mystery out of therapy. So therapy shouldn't be mysterious. And sometimes people have shared that it is, or it can be, which is maybe another reason why they don't necessarily pick that as a path for support and healing. But the path to permission is all about learning more about what to expect from working with me and what the therapeutic experience can look like as a whole. So I kind of use it as like a roadmap or a blueprint for what that looks like. And then we'll finish with next steps. Like, so what do we do with this information and where do I go from here? So let's dig right into those common myths. So I like to start with the first one, is that therapy is only for people with severe mental illness. Many people believe that therapy is only for people who have serious mental health disorders, and those can be defined in such a myriad of ways. It's pretty subjective. It's really based on the person's reality and what they're experiencing. But in reality, therapy can benefit anybody facing stress, relationship issues, as you mentioned, Nicole, some of those financial stresses, family issues when it comes to estate planning and trusts, and kind of all of the things that wrap all into that maybe we don't expect to have happen and that maybe just happen. And then life transitions. So when we think about that space, I like to think about it kind of in terms of going to the dentist or getting your car fixed. If you hear that rattle, and if you've ever been a place where you hear your car rattle, or maybe you have just kind of that little bit of soreness in a tooth or a toothache, and sometimes you decide you're going to do something about it, and sometimes you don't. And if we don't, sometimes it can get worse. So I like to talk to people about doing therapy in a way that supports them with where they're at versus waiting necessarily until it gets worse. All right, number two, therapy is just talking. As I mentioned, talking can happen in therapy. Um, Therapy is just talking and it doesn't solve problems. Talking might be a pretty key component of therapy in a sense that you're talking with somebody to process your challenges and to understand what you can do and where you can move forward. But therapists use evidence-based techniques and interventions for us to help our clients to develop skills, gain insights, and make positive changes in their life. And so talking might be a part of it. Somatic work is tapping into your body and really being able to kind of tune into how your body's responding to some of the things that you're experiencing. So when I work with clients, I talk about even though our brain is in our head and our head is attached to the rest of our body, a lot of times people working in therapy feel the disconnection, like, oh, I'm trying to think my way out of this, or I'm trying to do things to take my mind off of whatever it is that I'm experiencing. And sometimes that doesn't necessarily work. So it's kind of creating that brain body connection. All right, the third one, therapists are just going to tell you what to do. Therapists generally, I say that, so I can't speak for all of us, do not give direct advice or tell clients what to do. Instead, we want to be able to help clients explore their thoughts and their feelings and then empower them to be able to make their own informed decisions from the information that they talk through in therapy. So if you've ever heard from anybody that they said, oh, it's really nice. Like I'm meeting with my therapist and it's just nice to have somebody to talk to about my problems that's not biased and that's not embedded, like a friend or a family member. It can be great to have a family member, a friend, or a neighbor, or a colleague, or a community member to be able to confide in and have that relationship. But a lot of times therapy can go above and beyond that, providing that confidential and that anonymous support in session. All right, Nicole, I'm curious if you've heard this one from anybody before. Therapy's too expensive, Jolene. I don't have the money for that.
Yeah, absolutely. I think that it has definitely been portrayed as more of a luxury, something that, people that have disposable income can take part in. And I think that that's one of the things that maybe holds a lot of people back from exploring therapy because they just assume that it's something that they can't afford or, it's not really going to make the cut when it comes to your expenses. So absolutely.
Yeah, yeah. There's so many different ways to access therapy financially, but in the complexity of our world, like I appreciate you sharing, what you hear from people and what they say, because depending on who you hear from and what their experience was, everybody's is different. It's going to depend on the way that they access therapy financially. So I also look at connecting with clients and potential clients and helping them walk through that space. So I love when clients are able to use insurance and the benefits that they get through insurance. So I love to be able to educate people on how they can access that because sometimes trying to navigate a health insurance website can be more complicated than it seems when we go and take a look at that. Based in the Denver area, my license allows me to see clients in person in Denver or the Denver, Boulder, Colorado Springs-ish metro, depending on where people are coming from, but then also via telehealth across Colorado. So the reason I mentioned that is depending on the areas where my clients are located, there could be different resources, either no cost, low cost, sliding scale fees, or community mental health services that are available. And so if I'm working with a client and they share with me that they have access to some of these resources, or I'm able to find them resources that they can access in this space, it's a great way to be able to partner together. So, all right. So this last one is you'll be in therapy forever. Have you heard anybody share that? Or you'll be in therapy for a long time, maybe. Yeah, the length of therapy varies depending on the individual or couples or families' needs and goals. So, some people benefit from short-term therapy, and there are different modalities and frameworks that adapt to that. And others may choose to continue longer for ongoing support. So, coming into this field, I have always said that kind of like part of my value system is that I'm not all about maintenance therapy. So, what I mean by that is you go to see a therapist for the first time and they say, okay, so we're going to sign you up for noon on Tuesdays for the next year. And that can feel and seem really daunting. And it might also, if you're thinking about this, connect to the therapy is too expensive. And so people start thinking, I don't think I'm going to be able to commit to this. I don't have the financial resources, or that sounds like it's going to take a long time. So when I work and start working with clients, and particularly in the first session, I like to put this out on the table. And depending on what the person is coming in for help with and just how we work together and maybe some therapeutic or clinical insight that I might provide. We either work together every week for a few weeks and then kind of check in and see how things are going for that person. And if they feel like they're experiencing and doing some work on short-term gains in the direction of their long-term goals, then we kind of decide and go from there. So depending on the person's availability, depending on their modality, and also just depending on what it is that they're coming into therapy for. So it doesn't have to take forever. And also some people, therapy has evolved. I remember as a consumer of therapy earlier on in my life, like in my, I'd say teens and early 20s, um, I remember just it was nice to have that person that I knew I could reconnect with and I didn't have to start from scratch. So I'm giving you a little bit of a teaser when we get into your path for permission, and we'll talk about what that might look like for people who think, well, gosh, I saw this amazing therapist. I really enjoyed working with he or she or them. And am I able to, is it okay if I go back to them for something totally different? Or what does it look like if I feel like I've maybe taken a few steps back? Can I go back and see them for the same thing we were working on before? And what does that look like? Let me throw out a few others here and then I'll pause and see if we have any questions, and then we'll take a peek at the path to permission. Um, so another common myth that I hear is that therapy can be a quick fix. So this one ties into kind of the you'll be in therapy forever for a really long time. Some people can expect immediate results from therapy, and some people experience immediate results from therapy. I met with a new client today, and I always like to throw it on the first session, and sometimes we'll sprinkle it in throughout depending on the therapeutic experience. And I'll say, I want to be really transparent. There are no guarantees in therapy, but there is a lot that's possible. And because each person has a unique experience, I like to invite people to consider what that experience could look like for them. Another one is therapists can't understand what you're going through if they haven't experienced the same issues, which would be interesting. So, part of the like therapists will tell you what to do, or the myth of therapists will tell you what to do kind of ties into that. So similar to coaches or maybe people in other roles like that, or even when I think of real estate, Nicole, right? As a real estate agent and as a steward of that work, what you might want in terms of your real estate needs could be and may likely be completely different than some of your clients. And so by being able to just meet them where they're at and understand what it is that they're trying to accomplish with therapy and with working with me, and what it is that's initially bringing them in, we go through really extensive training in our programs to empathize and to understand a wide range of issues, even if we've not experienced them before. And I would almost say that sometimes, not always, it makes it even a little bit easier to be able to come in clear-headed and just hear what somebody has to say about what they're experiencing versus letting anything potentially cloud my judgment. Or bias on that. So yeah, our training equips us with that. And then we also do continuing education credits every year to kind of keep up to speed on kind of what the modern experiences are and the modern interventions and treatment paths so that we can meet people where they're at. All right, let me throw this last one in and I'll take a pause. Therapy is only for women. Oh, my wife goes to therapy. Oh, my roommate goes to therapy. Oh, my coworker goes to therapy. Oh, she loved it. Oh, she thought it was great. Oh, she found a different therapist. So this stereotype may deter men or those who identify as men from seeking therapeutic services, but mental health issues affect people of all genders. It does not discriminate. So therapy can be beneficial for everyone. And I have to say, for being in this field as an emerging clinician, so I've been practicing for less than 2 years, I never realized to the extent at which there are just different niches of different therapists and mental health programs that can support the needs of everyone. One thing we're not going to talk about today, but I want to make very clear is that there are different communities, different marginalized communities that have significant societal challenges from accessing therapy and mental health services. So that is something that I feel very passionate about and that I want to continue working with my other colleagues and community organizations and policymakers so that we can continue to strive for mental health services available to everyone. So I wanted to share these because by understanding some of these myths and helping to understand kind of the truths on the other side, I'd like to help people make more informed decisions about whether or not seeking therapy is right for them and maybe what they can expect in the process, which I know we'll take a peek at next.
I just wanted to make a comment too about that last thing you said about, in reference to therapies for women. I just love how this industry is really, getting out there, getting the message out there. And I do think it's becoming more common to see, different types of people becoming more okay with the thought of therapy. Like, this is something that is really good. These people are trying to help you. And it's definitely personal, but everybody should be allowed to take that step for themselves and really empower themselves to work on their mental health. So I think that that's just one of the most beautiful things about the way that things have progressed for the industry, getting the word out to all different types of people that this is a great resource for you, and it's exciting to see that kind of blossom.
Yeah, I appreciate that. I really do. I'm feeling and seeing that expansion and that acceptance and transition start to take place. Like we have some work like in many different fields, but just like kind of now being embedded in this field, I'm feeling it and seeing it. And then interestingly enough, as you were sharing that too, I thought this isn't necessarily a myth, but more of a truth is that so we have informed consent, which is like at any time a client can choose whether or not they want to share information with their therapist. So it's consumer or client driven. So even if I ask a client a question, we talk about this in the initial session, they don't have to share with me. So just because we're in this space, I'd like it to be more collaborative. And so interestingly enough, some people say, oh, because you're female or you identify as female, do you see mostly women? And I said, no, I walk through the world as a woman, so I understand what it's like to be a female in this world. But actually, when I look at my caseload, half of my clients are individual men. So it just depends on who. I'm really huge on fit, so we'll chat about that here in just a moment when we talk about the path to permission. But it's really key when you think about how vulnerable therapy could potentially be and the work that you might be doing in that space. I would say that one of the biggest things is fit. So whether or not you kind of feel the right vibe, like, hey, am I going to feel comfortable with this person working on some things over a period of time? And do I trust them? And do I trust being with them? So, yeah. All right. Well, let's pop to in the second half. Let's pop to your path to permission and take a peek at this. So I had mentioned this is kind of what you can expect. I would say this is what you can for sure expect when you work with me. And this is what maybe you should expect when working with a mental health therapist. So different therapists, different modalities. I do therapy in person in my office in Denver, just off of 48th and Sheridan in North Denver or Berkeley. And then I also see clients via telehealth across Colorado. So the first thing that somebody might do is to schedule a call. I offer free phone call or free video consults. So depending on where people are at and how they're accessing this consult, it's an opportunity for them to set up time at their convenience using my online booking tool for us to talk for 20 minutes and kind of just understand, like, a lot of people think, okay, is this therapist for me? Am I going to like them? Do I feel like I can actually make the changes that I need to and want to? Is there any hope? And importantly as well, is this person available to see me? Do they have openings and space? And can I access them financially? So right now, I'm considered an out-of-network provider, which means I'm private pay and I do not currently take any insurance. Might be an option in the near future. I'm exploring what that looks like. And so the consultation call is designed to answer all those questions and for the therapist to also understand right fit in terms of what's bringing the person into therapy and what their goals are and hope they accomplish. So step two is like, okay, if you decide, hey, I am a right fit for you, I then typically during our consult, I'll invite the person to book a first session at that time since we're there live. And I know everybody's pretty busy. So trying to exchange different schedules sometimes can be a little bit tough outside of that. So if a person or a client or a couple feels comfortable, we then book that first session or maybe even a few sessions just based on time and availability. And that first session is really our first time together meeting, our formal intake session. So I say to some people, it can sometimes feel like an interview. because I like to let the client, it to be the client's time. And they may have a lot to share throughout the course of our work together, but it tends to be especially at the beginning because they want to be able to, in number 3, share their story and allow them to dive deeper into what's bringing them into therapy. So in the intake session under the Let's Meet, it's when I ask a series of questions, specific questions in a specific order to understand more about the person's lived experience and what support has worked or what hasn't worked in the past, and what's bringing them into therapy. And then also what's their vision for this experience overall so that we can really understand where we're meeting each other. So in sharing their story, I'm able to really better understand or get to start to, it doesn't all happen in that first hour or two, the full context of what's causing their distress. How long has it been going on? Who else might they have for support, and just really understanding kind of the entire ecosystem of that person's life. And then also kind of understanding like this is maybe an area we may want to dig into a little bit further, and this might be an area that we may not need to focus on right away. So we kind of prioritize defining what the goals are and what areas we really want to focus on first. Number 4, we dive right into defining goals. So yeah, when life is chaotic, it often feels like everything needs to be fixed. Like it's all urgent, which then in a sense, it kind of none of it is. So I partner and collaborate with clients to define what the milestones might look like. And then the client is able to gain some clarity around what they can focus on and prioritize at that time. The cool part about this is under number 5, when it says follow the path, as we work together, you or as a client will decide how you can begin taking new actions and experimenting with making the changes to be able to move forward. So I look at this experience as by design. And so even though we define goals and we kind of outline a bit of a roadmap or a blueprint, um, it doesn't necessarily mean we go in a straight line. So I think about like, Google Maps, and it's like we don't always go in one direction. Progress is rarely linear, but is always moving forward. It just may be a little bit more squiggly than we thought. The second half on this path that you're taking is we're getting into the discovery and exploration of what this looks like. And in ensuring alignment, step number 6, I'll check in along the way when we meet, and we'll continue to take time to adjust and refine the goals and how you're taking action to support them. So I usually connect with my clients on like a feedback loop, like what's working, where are you getting stuck, and what do you want to do differently? And how can we be the scientists of our lives to understand what is going to work for us? I also want to be sure that we're continually aligned. And I welcome feedback always about what is working and what's not with the therapeutic process. So it's kind of a few different levels when it comes to that. At this space, it may be that you're increasing confidence, stepping out of your comfort zone comes with its own uncertainties. So I'll be your guide on the side to collaborate with you as you build upon your existing strengths and maybe some that you never knew were in the wings or kind of some that you had to dust off to start making some of those maybe bigger decisions and changes with confidence and with support. At this time, it could be you're really growing that sense of awareness and your sense of self. And it's not uncommon to sell yourself short or overlook the progress you've made because meeting those goals and kind of using those smaller goals can be fuel for success for bigger goals. So we'll take time during sessions to celebrate your wins, reinforce the awareness that you can thrive and not just survive. And then we also take time in step number 9 to reflect on your journey. If you come to a point where you feel like, I feel complete with what I have come here to do, but I don't know what's next or how this all works. As we wrap up this therapeutic journey for you, we can talk about options and what you want to do if you like support in the future. So it could be that we keep our lines open and, I kind of say to my clients, it's not goodbye. It's just like, I'll see you when I see you, and they know where to connect with me. And also if they connect with me at a different time in their life and it's not a right fit at that time, I'm happy to provide referrals or recommendations for somebody that might be a better fit for what they're looking for at that time. So, we've been busy on this path to permission, and with it being in the 80s and 90s here in Denver, I imagine we may be a little perspiring a little bit as we've been taking this journey. Nicole, I wanted to pause and just see if you had any comments or questions on what I shared here.
A couple of things did come up for me. And one was in terms of like finding a good fit, which, this whole kind of process is about, maybe those first couple steps that you had talked about, like how many people, or what would be something that you might recommend? How many therapists could somebody maybe interview before maybe they find the right fit? Or is it more, maybe I'll take a chance on Jolene, we'll see how it goes, we'll have our first couple sessions. If it's not really working, then I can make a switch. I think about it in terms of, like other practitioners, maybe not the dentist, but maybe like more of a personal doctor, or going for a second opinion on something. Like, are you finding that people kind of like to interview a couple of people to see who might be the best fit for them?
Yeah, that's a great question. And I even think about it for myself. I say that because therapists see therapists, as they should. Dentists see dentists, doctors see doctors, picking on all those dentists today. I like the number three. I think about it in terms of providing kind of a little bit of well-rounded data. So um, depending on, again, the person's time and their resources to be able to set up three consults. I'm a big proponent, and I believe almost every therapist I've ever met with allows for free consults, whether it's like 15 or 20 minutes or half an hour, depends on the practice. And that way, I'd say to balance that with like, if you know, you know. So when I have consults with people, I will also tend to ask them if they've had any other consults with anybody else, not because there's any conflict of interest there, but because if they haven't, I'm happy to actually provide other referrals so that they can just see what's out there to make sure that it's the right fit for them. Or if they really feel like, hey, this really does feel like a right fit. I've really jived with this conversation with you. Let's go ahead and set up those first couple sessions and then kind of work our way through there and take the path to permission.
Great. And then in terms of like expectations, maybe somebody is new to therapy and they're not really sure if it's for them at all. How many sessions do you find, like as a minimum, that somebody should be prepared to commit to in order to kind of try it on for size and see if it is a good option for them to continue with? Do you find that anybody not solves their problem so much, but like gets what they need from like one or two or three sessions? I just to set like more of an expectation, not so much like I'll be in therapy for forever, but if I'm going to take this step, maybe I want to
Yeah.
make sure it's during a season of life where I can really commit to um, the process. Maybe it's not going to be beneficial over the holidays, or if I'm planning on being out of town. Um, what would you say in terms of like session count, or just setting expectations?
That's also a great question too. And I'm not just saying that to say that. I'm saying it because a lot of times the whole therapy will take forever or it will take a long time. The ambiguity around the timing for people, especially, I mean, the seasons of life, that really resonated with me when you said that. I would say somewhere, I use that phrase like short term, kind of some short term relief in the direction of their long term goals. So depending on what the person is coming in with, and maybe what they have ideals for their goals, and we can kind of talk about it to prioritize it. It could be, session 6 that they're like, oh my gosh, I've been thinking about what we've been talking about, and I think I'd rather prioritize this because that seems to be more of an issue that might be causing what I originally thought I was coming in for. Could be 10 to 12. I share with people initially like try 4 to 6 sessions. And I say initially weekly because it's going to provide the momentum, or it could provide the momentum that they're looking for to be able to really process whatever's bringing them in. I would say I typically, unless it's a high risk or critical situation, don't see clients more than once a week. I'm not an emergency therapist as well, so I provide resources for my clients that might need higher levels of care, or I refer people out if it's out of my scope of practice, or they also need higher levels of care. So I typically meet with clients once a week. Once we get going, sometimes we'll look at every other week, and then also same thing with timing. So sometimes clients want to meet initially for like 75 or 90-minute sessions, and then we taper off to every other week to 50-minute sessions. So there's a lot. That's why I said nothing's guaranteed, but there's a lot that's possible. And I like to help people just create the own experience that works for them.
And actually, just on a final note, I'm glad you just resaid that, because that was one of my favorite things that you had said from the beginning, is that like there's no guarantees in therapy, but a lot is possible, which is just, I think, a nod to like the optimism that, you know, we can grow and we can change and things can be better. And even in the case that maybe things aren't really so bad, but there's always room for growth too. Maybe you don't have a quote unquote problem or something to fix or something to solve, but like you can always, you know, go a little bit deeper and grow from an experience like this. So
Yeah, absolutely.
thank you so much for joining
Awesome.
us tonight. Do you have anything else to add as some parting words for our viewers?
No, I think that that phrase felt just really relevant, the nothing is guaranteed. And I would say it probably just kind of applies to life in general. Nothing is guaranteed, but as a lot is possible. And in the work that I do with my clients, and I welcome all of you, if you're curious about therapy, even if you have just questions or anything and don't necessarily want to set up a consult or for a session, I shared my information and I believe you're going to be sharing it out with the group as well. But, people said, oh, I feel bad if I change my mind, in terms of things going on in their lives. Like, how is somebody going to react or how is this going to impact somebody? And it's like, you didn't change your mind. You just made a new decision based on new information. And that's where helping people talk through what they're experiencing to help them better, to help them identify and better inform what they're going to do moving forward. And that's kind of the intersection of this work. So I'm so grateful that you allowed me to come into this space with you and for us to collaborate on this conversation.
Thank you. So I will be dropping Jolene's information in the chat or in the comments below, so you can, you know, reach out to her or just check out her website if you're curious. Thank you for joining us for the Family Protection Planning webinar series. I really appreciate it. And again, this will be recorded, so you can reference it. You can send it to people if you think of somebody that might benefit from it. As always, Jolene and I are both available for questions or comments. And thanks again, Jolene. Have a good night,
You're so
everybody.
welcome.